Hello, everybody. My name is Dr. Austin Henley. I'm a PGY2 resident at uh, Stillwater Medical Center's Internal Medicine residency program. And I'd like to give you a brief overview of my QI project. My goal was to basically design a visual aid in the outpatient setting that could be used to try and increase the patient's willingness to undergo pneumococcal vaccination if they were eligible. Community-acquired pneumonia is a very common medical disease which causes a lot of morbidity and mortality, especially in older patients. So family practice physicians have done this in the past, a study in the past to see what would work, and from their efforts, they showed that informative brochures and clinician reminders were particularly effective. So I wanted to see if this played out in another setting. So the visual aid really consists of these CDC recommendations in the middle of the poster, along with these high-risk qualifiers. I particularly emphasize the high-risk qualifiers because a lot of these patients, there are many patients on a census that have tobacco use or CHF or CKD who are not being actively recommended the Prevnar vaccine or pneumococcal vaccination because they just don't meet the threshold of 65, which we're all most familiar with. So something I wanted to emphasize. I've got about 50 patients involved in the study as of May of 2026. I'd like to continue it into the next year to obtain more data and then do a more detailed data analysis. But our preliminary results are pretty encouraging. About 9% of patients were willing to be referred for vaccination at a pharmacy or based on the visual aid and my patient education. So um, I think this is a promising topic and just kind of a reminder that, even basic things, is just taking a few extra minutes to talk with a patient about, why this matters and if they're eligible can make a big difference in their lives. Thank you.